Thanks to Reem and the panel for the discussion on advocating for better quality of life for patients. My session is about lessons and success in patient self-advocacy, being your voice, an Australian perspective on cancer care. So in this session, I'm going to talk about what does it mean to advocate, how does it impact you, planning, tools, case studies, how not to do it, and how to advocate well and other advocacy. So what does it mean to advocate? It means to actually get educated about what's happening with you so that you can be your voice and you can be your choice of what to do. So getting your information from the correct or a reliable source is really good. Dr. Google isn't that reliable source. Quite frequently you'll get misinformation and that'll end up with more problems because you become sort of confused with what's happening with you and you haven't got the right information. You need to make sure that you have a good trust with your doctor and your healthcare team so that you can then work with them and that you can talk to them however you need to let them know what's going on. So by doing all this, you empower yourself to be able to be a good advocate. You need to have a good partnership with your family, with your healthcare professionals, especially your doctors, so that you can then work together and you can ask the right questions and be informed as to the right decisions. Communication is essential so that you can actually voice how you're feeling and talk about it with your doctor and discuss things so that it's going to be your best option. And through all this, you'll have improved outcomes. So preparing for an appointment, it's really important that you have a diary that you can keep. So whether it's electronic or whether it's a paper one, but also having a notepad and pen beside your bed so that when you wake up in the middle of the night, as most of us do, and your brain is going at 100 miles an hour, that you can write down what's worrying you, what you're thinking about, or questions that you might want to ask. That way, when you wake up and you might not remember it, you'll at least have it written down there, so it'll make it easier. So when you do go to your appointment, that you have questions that you want to ask the doctor. And also making sure that with having those questions, you can streamline your appointment because frequently you don't have a lot of time. Having a support person with you is really important also, so that you've got another set of ears. And sometimes when you're talking about things, you can't remember it all, and having that set of ears there to hear it and also to bring up things that they feel might have been an issue is something that is going to be very valuable. A lot of you out there might be business people, so when you go to a meeting, you always have an agenda. So going to an appointment is like being in a business meeting, making sure you have that agenda and that you can tick off all the items that you want to address. Prior to going to your appointments, you need to make sure that you have all your tests and imaging done so that you can have the results available to you. Having those results makes the actual consult a lot more valuable, especially if they're reviewing what your treatment's doing, whether there's any need for a change, and it just gives a really good background of what's happening and makes that appointment worthwhile and beneficial to you and the doctor. So questions to ask. At the side there, we've got a QR code for a fact sheet that we have on our website. So feel free to scan that and use those questions. But when we look at those, we look at general questions to ask. So what sort of cancer I have, going through, who should I go and see about this cancer, having tests done, what tests you need to do, whether you need to prep for those tests. What are the costs? A lot of the time we don't know that. Staging, we need to know where the cancer or your disease is and where, if anything, it's spread to other organs so that we know what the prognosis is. With neuroendocrine cancer and many cancers, it's really important to have your management done by a multidisciplinary team so that you can get the input of all the doctors from different specialties and get the best outcomes. Knowing about what treatments are available to you, what the side effects are of those treatments, and also why you can't have some treatments. Knowing about clinical trials that are available to you. Our website has them listed for neuroendocrine cancer, and there is also a website called Ancora that does a lot of clinical trials internationally. So it's always good to just ask a question about those with your doctor and knowing where to get support. Patient organisations are a superb place to go, like Neuroendocrine Cancer Australia. Also knowing who to reach out to as far as your team, family members, and also sort of other organisations such as the Cancer Council in Australia that can provide other information, especially like financial and just other things that are not normal. So there's tools. I'll just briefly touch on this, is the treatment and wellness care plan, which is comprehensive, and it's for the patient to record all the information that's happening with them with their cancer. So if they go to a hospital or another clinic or something, there's a streamlining of the information. Most of the hospitals in Australia don't have the same medical record. So having this, it's much easier for the patients to be able to have access and for the doctors to know what's going on. So I'm just going to touch briefly on a case study about Ben, who doesn't communicate well. He has esophageal cancer, and he's your typical Australian man who is very stoic. I'll be right, mate. Don't worry about it. I'm good. But he wasn't good, and he had a lot of pain. He had decreased swallowing. He had weight loss. He had treatment-related side effects from his chemotherapy, but he didn't communicate those to his clinician. So his issues were not addressed. He had very poor outcomes. He had increased hospitalisation because of the pain and the weight loss and the side effects from his treatments. He had a decreased quality of life, and all this impacted on his family members as well, who just didn't know what to do. This is a case study that is about Kate, who's a lung neuroendocrine cancer, but Kate knows how to advocate for herself, and she's educated herself. She's got a less common cancer that has a lot of associated side effects and a syndrome called carcinoid syndrome, where she might have issues with her heart, and sometimes she has to present to an emergency department with a racing heart, with AF. So by educating herself about that, she's able to educate the healthcare professionals of theirs. Many don't know about neuroendocrine cancer and these associated syndromes. And there are less medications and investigations that are available for these patients. So by doing this partnership with her healthcare team and also with patient organisations such as ours, she has her issues addressed, and she feels like she's able to communicate well and speak to her doctors about what she wants. Other advocacy, we've got lobbying of politicians, which then creates awareness of the issues. So patients go to their politicians and speak about their case because the patient voice is so strong. And having those politicians then be the advocate in Parliament and in the community. And they can also push for change to improve outcomes with health policy change. There's also peer advocacy. So by knowing about other patients that have got cancers the same, that they break the isolation and they don't feel alone. And they gain strength through being in touch with each other and helping each other. And there's also non-government organisations such as Neuroendocrine Cancer Australia. Again, here is the QR code so that you can go to the questions to ask for consultation. And there's also INCA, which is the International Neuroendocrine Cancer Alliance, that has a good patient advocacy toolkit available. Thank you so much for giving me the opportunity to do this presentation. Next, let's welcome Professor Hesham El Ghazali, who will share with us insights from Egypt's successful National Breast Cancer Screening Awareness Campaign. Welcome, Professor Hesham.